Hey team, Dave Grovedahl, Chief Cumberland County EMS. Here today with Christopher Dudley, one of the newest community paramedics that we have in the system. Wanted to give you a little introduction into Chris. Some of you guys have met him already, either on scene, either here at base, or you've heard a discussion about the community paramedic that's been out running calls. So just wanted to give you guys an idea of who Chris Dudley is and what his program is going to do. So Chris, welcome. It's great to have you here. If you want to tell us just a little bit about yourself, first where you come from, and then we can talk about what you're going to be bringing to the table.
All right, so I am from Wilmington. Worked in Onslow for about 7 years, 5 or 6 of those years underneath David. I have a Master in Health Science from Western Carolina, 4 kids, 2 in college, and been a resident of North Carolina pretty much my entire life. So I was born in Virginia, been here 50 some years.
All right. So you and I did work together in Onslow County. So there's the disclosure statement for today. We did work together in Onslow County, and tell us a little bit about what you did there. You were a community paramedic at Onslow County, and once again a community paramedic here. What kind of programs did you work on?
So in Onslow County we developed several programs. We had a behavioral health where we did telepsych video with patients out in the field. We were doing IVCs out in the field. We also worked with law enforcement. We had a co-responder program where we actually had licensed clinical social workers and peer support that would either go out to calls in conjunction with us or separately, that we would work together as a team. And we also had a substance use program where we would do buprenorphine inductions out in the field and then dose those patients up to 7 days, and then do a warm handoff to an outpatient treatment center, or if they weren't a candidate for MAT, then we would work at connecting them to either outpatient therapy or inpatient, short or long term. So there were a bunch of different programs that we had that we implemented that focused on behavioral health and substance use, and we are going to be bringing some of those programs here to address a lot of the needs the community has here.
So you talked about mental health. Mental health is obviously a call that we go to every single day, multiple times per day. We know that the patients that are mental health patients, on average, will spend about 13 hours in the emergency department, spend about $2,200 for their visit, only to be turned out from the ED to be followed up with a behavioral health. Our goal here is that we want to make sure that we get patients to the best place the first time, and a lot of times for mental health patients that's actually not the emergency department. If we can get them to the Roxy Center, the crisis center, if we can take them to another place, that's really going to be our goal. So really, first and foremost, you're going to be responding out to a lot of behavioral calls and substance abuse calls. What kind of things are you going to be doing on that call?
So some of you guys have actually had me show up on scene. Right now, for the next few weeks, I'm trying to get a feel for how the system responds and what the resources are, so that come the end of December, January, when I show up on scene, I will have built a pretty good resource network, and I'll be able to direct these patients where they actually need to go. If they need to go to the ER, then obviously we'll get them there. But if they can go to RI, or if we can do a video chat with an ER doctor, or if we can get medications filled or get them redirected, then we'll do that to eliminate that transport. And then we will also work on doing the same thing with any patients that are struggling with substance use or have overdosed. It'll be kind of the same framework on trying to get them to the most appropriate resource, or get them connected shortly afterwards.
So our community paramedic program does rebound patients that have been discharged from the hospital, congestive heart failure, working with patients who have respiratory problems, really trying to keep them out of the ED. This is a whole new direction for us, and so you're a one-man band at the moment. Our goal ultimately is to expand this program so that we can actually start responding with QRVs to some of these behavioral type calls that don't necessarily need ambulances. But as long as you're a single provider, are you going to be 24/7, 365, or are we going to see you hit and miss throughout the system?
So right now my schedule is Monday through Wednesday every week, and every other week it'll be Thursday also. You will see me overlapping. I'm usually here till about 9:30, 10:30 at night because I'm trying to catch night shift too, especially while we only have myself doing it. Once we do expand, then our ultimate goal is going to be to get coverage every day, and then ultimately 24-hour coverage. So as we're kind of ramping this program up and expanding it over the next 6 or 8 months, there should be more staffing coming on, and you'll see those hours increase as far as all the different crews having access to a behavioral health or substance use CP. If you guys have calls that you feel like would benefit, I want you guys to please send me a message. You can send me an email in Verico. You can send me a little bit of information if you want, but more specifically, if you can send me the run number and then any issues that you think I might be able to address. And before we wrap up today, I'll make sure that everybody has my cell number also, so you guys can call me day or night, text me, and I will get back with you if you have an immediate question.
Now, normally this would be where we would flash his name, phone number, and his email address at the bottom, but we are not that tech savvy just yet. Maybe in the next couple of months when we start to figure this stuff out. But as of right now, it's Chris Dudley or C Dudley at CapeFearValley.com. You've got your phone number,
Yep.
which is
910-705-2449.
So just one wrap-up question. When you get on scene and you're there to help, are you taking over the call? Are you going to be writing the charts for them? If the crews see you coming, can they hit deuces out and tell you that the patient's over there and they can bail out? Or would you like them to stay and participate in that call?
I mean, it's going to be a case-by-case basis. Obviously, if it's something that I can redirect, I will take that call, and the crews will just do a refusal. If it's a transport, they'll have the call. If it's a patient that I feel like maybe I need to go in with, I certainly will ask them if they're okay if I take lead on it. But that's not necessarily what needs to happen. The end game is to just make sure we get those patients where they need to be. At that point in time. So probably a little bit of all of the above.
Okay. So you've met Chris Dudley, community paramedic. Going to be working with the mental health and the substance abuse. You guys will see him out on calls. Could be during the day, could be at night. As the program expands, we'll continue to open up the availability that we have community paramedics available. But for you guys that are out on calls, if you happen to hear a community paramedic, a 400 series responding to your call, chances are that's Mr. Dudley coming out. He's going to check in with the patient, hopefully address whatever the mental health issue is, and then help make the determination as to what is the best destination for that patient. We definitely encourage you guys to reach out, talk to Chris, learn a little bit more about what his goals and his plans are for the program. And until we see you next time, you guys be safe out there.